So I'm Panos Kanavos and I coordinate the activities of the Medical Technology Research Group at LSE Health, which is part of the Department of Social Policy. And I'm going to tell you a few things about the kinds of research, the type of research that has been going on in that group for the last year and a half. The first area of research relates to a study on the sustainability of healthcare systems over the next 10 to 15 years, where we are studying the impact of macroeconomic, fiscal, demographic and technological pressures on healthcare systems and healthcare system financing. The second issue relates to work that we have been doing over the past 5 years, and it is ongoing, for the European Union, in particular the European Commission DG Enterprise, and a network that is funded by the European Commission, which is called the European Medicines Information Network. And in the context of that network, we have been working with the Commission and the ongoing presidencies of the European Union on risk-sharing agreements and a methodological framework that needs to be developed to study and take account of these agreements as they relate to the financing and coverage of new medical technologies across the European Union. The third issue, which is again a piece of research funded by the European Commission DG Sanco, is work on rare diseases. It's called the BERQUAL project. It is an acronym that stands for Burden of Disease and Quality of Life, and we're studying really the cost and socioeconomic impact of 10 rare diseases across the European Union. And we also want to see what are the cost drivers for rare disease patients, but also their carers and their families, and what is the impact on quality of life. The ultimate objective of this project is to create a large database of about 5,500 to 6,000 patients, rare disease patients across the European Union, which will also enable us to study health technology assessment approaches to coverage decisions for rare disease patients and so on. And that brings me to the next issue, which is really important and has to do with the affordability of healthcare services, but also about the methodological tools that need to be developed in the future. It is really the issue of health technology assessment, where we have done work for the European Observatory on health technology assessment issues, and we are starting a project funded by the European Union DG Research under the auspice of the FP7 program on health technology assessment. We are calling it Advanced HTA, and really the objective here is to study and to develop new methodological tools related to value of medical technology, value of medical devices, study methodological approaches of how to deal with interventions in rare diseases, how to incorporate patient-relevant outcomes into our decision-making process, and also how to build capacity in countries in Eastern Europe, but also other parts of the world, particularly Latin America and Southeast Asia, on health technology assessment, because that's a tool that will help us into the future appraise and assess the medical technologies across the board. So these are the kind of issues that the group have been working on over the past year and a half or so, and we're really looking forward to continuing our ongoing collaborations with our network in the near future, and particularly developing, and this is very exciting, new methods for health technology assessment.